I had some eyelashes put on, those eyelash extensions. I was scratching my eyelids, my eyelashes, like this. I'd pull this up and I'd scratch my eyelashes. I had all these eyelash extensions on, and I pulled them all off my eyes, all off my eyelids. So I'm pulling these off, and I'm feeling worse and worse. I mean, I'm feeling like jet lag and a hangover. I'm taking 1 Advil, 2 Advils, 3 Advils. I tried to sleep. I could not sleep. I felt awful. Marilyn said, find out what kind of glue they're using. So this lady was kind enough to fax the sheets to NAET, and they called me back and they said, this says it's for airplanes, and it is to get it's to get nowhere near human skin. She said, I'm going to treat you, but first of all, I want you to be dressed. I want the boys to be dressed. How far away is the closest hospital? Yeah. I said 10, 12 minutes away. Why? She said, because if this treatment doesn't work, I want you to go to the emergency room and ask him for a shot of Benadryl. Tell him your doctor sent you. Okay. So I got my clothes on. I got the boys' coats on. It was, you know, in the winter. I called and I said, all right, I'm ready. We've got our coats on. She said, all right, I'm going to treat you. And I was sitting on my bed in the bedroom with my coat on. My boys, you know, little boys right here. And I could feel every place where I had told her I ate. My neck, back of my neck, on my chest, my arms, the tops of my legs, my, you know, waist in here. It all started constricting like one of those blood pressure cuffs in the grocery store. But you know what? I was really calm. Even when it was constricting my neck, I was calm. Because I had done enough of these treatments to know that I would be okay. Kept constricting. I don't know for how long, maybe a minute, maybe 2. And then all of a sudden it went just like the blood pressure cuff. Kind of went like this, and the odd thing was is I could see I don't know, every once in a while, a black dot and like a magenta dot going, I don't know why, but going around me. Maybe it's an energy thing. And I felt better, like 100% better. And I looked at the kids and I said, well, we've got our jackets on, let's go to McDonald's. And I mean, 15 minutes before that, 10 minutes before that, I felt so awful that I couldn't get out of bed. You know? I just think it's amazing. I was going back and forth from Denver to Albuquerque, took a shower, and I start doing my hair. My hair just, it wouldn't do anything, nothing. And my skin felt like it was burning. I mean, it felt like I was like dry, cracked wood, and it hurt, and it's done. I put lotion on, and it still hurt. I mean, it's done. This is all in like 3 hours, and I was just, oh my gosh, what's going on here? I mean, you know, your hair is just seriously going straight up. No amount of conditioner is doing anything really, and then I'm burning, and my eyes are burning. So I call Nancy, and I tell her what's going on, and I tell her, you know, you gotta take care of this right now. I mean, this is just, this is awful. I'm burning. Pins are pricking in me. She calls back and she says it's the tap water. They put something different in the Albuquerque water system since you came down the last time. And we get newsletters in the subdivision that we were in that we're adding this to the drinking water. And I knew when she was treating me. All of a sudden, I felt bright. It just stopped. I mean, it totally just stopped. And I was fine. think it's interesting that Americans don't adopt what an allergy is or isn't, and they don't look at cancer as an allergy or eczema as an allergy, tendinitis as an allergy. But I think it's Oriental medicine. They say an allergy is something you're drawn to or you stay away from. And she was certainly correct. And she asked me before she put me on the table, what do you crave? And I said, oh, that's easy. Oreos. Oreos and milk, peanut butter and jelly sandwiches and milk, and Twizzlers. Oh yeah. So obviously I got treated for those. The first thing I do is I crack it open and then I give it a whiff. Oh, heaven. Heaven, I'm sure smelled like red vines. Oh yeah. Oh yeah, it was that bad. Now, you know, it's nice. It's pretty nice. It's not heaven. I don't really crave anything anymore. So, she took that away from me, the cravings. I could tell when I have a craving or when I really want to stay away from something that I can't. I know that there's something out of balance. I do approach people who have said to me, I don't know what to do. We've been to so many doctors, and that's how it was for me. You know, I couldn't accept what I was hearing from my doctor. I will say, you should go to my doctor. I've been going to her for 7 years, and she's never been wrong. People need their pain, or people need their problems. You hear that all the time. I know a couple people who are like that. They've seen me go through this year after year with problems and things get better. And these people are still trying to cure it with traditional medicine and they're not getting any better. They do make their own ills instead of cure their own ills. They say they thrive on that, and I guess you do have to have something to have a problem with. Some people really do. I don't want any problems. I don't want my kids to have any problems. I had taken my son to so many different doctors, and I really wanted him to get better. The thought of him being weak or getting steroid shots the rest of his life just made me sick. When you will do anything to get better, you'll go to NAET. It's that easy. If you really want to feel better, you will go there. You'll do anything. You will open your mind. You know, if you told me 10 or 15 years ago I was going to go to this woman and she was going to treat me long distance, I would have thought, you're crazy. You know, there is no way. That's quackery. I don't know what it is. I know it's got to do with radio frequency. I understand that that affects our biology. I know that, and that's like really all I need to know.